When designing I Am Well as an optimal healthcare experience, we were able to come up with a system of membership-based practice. This means that we're not limited by insurance. Our members pay a flat monthly fee for all of our services. Folks ask often, does that mean, do I still need insurance? And we're always quick to say yes, it's important to have insurance for unforeseen hospitalizations or surgeries, but we do all of the legwork on our end to work closely with your insurance company to make sure that things like labs, imaging, x-ray, that sort of thing, referrals are all covered. Our patients have 24-hour access to us by phone. We're happy to answer questions and talk to people on the weekends. If anything comes up, if we can save you a visit to the immediate care, we'd love to. We also have unlimited visits, so sometimes we're working with clients and we'll see them several times in 1 week, and other times less frequently. It's all covered with the same membership fee, no additional fees. I'm often asked what internal medicine is. It's an adult medicine specialty. I trained for 4 years at Providence in Portland. Internal medicine really has a background focus on all of the main organ systems of the body. We spend time studying critical illness in the ICU, and then outpatient and inpatient medicine clinics in cardiology, endocrinology, neurology, just to name a few. With a wealth of knowledge in adults, we're able to provide more cohesive care for our patients with fewer unnecessary referrals. We're also able to really coordinate care among specialists in the community. So our members are never left to navigate the healthcare system on their own. We're there every step of the way to speak to specialists, coordinate referrals, even call and make appointments if necessary for our patients. Internists don't see children, and I don't have any training in pregnancy, unlike your regular family GP. But it is a great place to come if you're focused on wellness, holistic healthcare, getting the best treatment for your chronic diseases, and of course, preventing illness from happening in the first place. One of the ways that I'm Well differs from my old internal medicine practice is our focus on holistic and functional healthcare. We've cut through all of the research and data and incorporate all of the complementary medicine techniques that are effective, both cost-effective and evidence-based, so that our patients know that they can kind of get all of the things they need in a one-stop shop. We offer comprehensive hormone assessment and hormone replacement for menopause and andropause. We also offer supplements and balancing of both metabolism and vitamins. We're able to guide our patients and offer great quality vitamins and supplements at wholesale prices.